In metastatic castration-resistant and androgen receptor targeting agent or ARTA-resistant prostate cancer, the androgen receptor continues to fuel disease progression. In men diagnosed with advanced prostate cancer, the mainstay treatment is androgen deprivation therapy. Unfortunately, in almost all men, their disease will progress as they develop castration-resistant prostate cancer. Androgen receptor targeting agents, ARTA, are generally used as the next line of treatment to overcome hormone resistance. Up to 25% of men will not respond at all to ARTAs, and by 1 year, 75 to 85% of the men that respond to an ARTA initially will develop tumor progression. These men now have castration and ARTA-resistant prostate cancer, for which there are no approved effective therapies prior to chemotherapy. Metastatic prostate cancer that has become refractory to newer generation ARTAs and prior to IV chemotherapy remains an urgent unmet medical need for patients with advanced disease. SABIZABULIN is a first-in-class oral cytoskeleton disruptor and androgen receptor transport disruptor that targets and cross-links alpha and beta tubulin. The androgen receptor complex is transported by specialized proteins along the existing microtubule scaffolding within the cell, acting as a railroad track or highway system to transport the receptor complex into the nucleus. SABIZABULIN prevents this process by disrupting the microtubule tracks. In prostate cancer, this results in the disruption of androgen receptor transport from the cytoplasm into the nucleus. The targeted mechanism of action is based on the important function microtubules play in the trafficking of the androgen receptor to the nucleus. Further, inhibiting microtubule polymerization disrupts the cytoskeleton and therefore arrests cancer cell division, which is an AR-independent mechanism. Among its preclinical properties, SABIZABULIN has high oral bioavailability and is not a substrate for multi-drug resistance proteins. In a recently completed Phase 1b and 2 clinical study, SABIZABULIN has demonstrated efficacy in men with metastatic castrate and ARTA-resistant prostate cancer, with some men remaining on study with stable disease for more than 2 years. Phase 1b and 2 studies have shown SABIZABULIN to be well-tolerated, without clinically significant neutropenia, neurotoxicity, and myelosuppression. Like an ARTA agent, chronic oral daily administration of SABIZABULIN is feasible. SABIZABULIN is an exciting first-in-class agent, and if approved, will be added to the armamentarium for the treatment of metastatic castration and ARTA-resistant prostate cancer.